I'm James Sutton. This is Road to Recovery. I'm a person in long-term recovery, and my special guest today is LaTonia Rich, the Executive Director of Tree of Hope. LaTonia, welcome.
Thank you, thank you.
And who is this you brought with you?
I brought with me the lead peer for STEER, Katie Lee.
Hi, Katie. Good to see you,
Hi,
too.
good to see you. Thanks for having me.
So today we want to talk about STEER. So what is STEER?
STEER is a crisis intervention team for Montgomery County. We respond to hospitals, EMS, crisis, police, as possible diversion, and for substance misuse. You know, so it's a 24-hour team. They go out 24/7. It was 3 a.m. or 3 p.m. and respond to any substance misuse situations. So when they report, they'll offer treatment.
Okay.
If that person declines treatment, they'll say, well, can I check on you? So then that segues them into peer support. So no matter what they choose, they follow them for 6 months.
Wow.
Mm-hmm. Right, throughout the continuum of care, or just helping them build, discrepancy in what they're doing. They might want to change their mind, change direction. So even if they're still using, that peer is still walking with them to try to help them figure out how to live a better life.
Okay.
Right.
So how many peers do you have? Are they peer specialists, or what are they just peers?
They're certified peer specialists. A couple of them are not quite certified, but they're working towards their certification through Tree of Hope.
Okay. And how many do you have working in Montgomery County?
There are 4.
4?
Mm-hmm.
And which are you just in Up County, or which hospitals do you cover?
Well, I'm going to let Katie answer some of these questions.
Okay.
She's on the ground, right?
Yep, we work with all Montgomery County hospitals.
Okay.
Yeah.
And so, Katie, since you're the one actually doing it, so what's your typical day look like? What happens? Okay, so the police call you, or does your phone, do you have a scanner in your car, or how does it work?
So if I'm on an on-call week, either I will get a direct phone call from somebody, or I will get queued via email, because we actually have a QR code that's in all hospitals. It's also passed on to crisis center. Police have it where they can just easily scan this QR code, fill out the prompt with all the individual's information that they want to refer to us, and a callback number for them. So I'll get that, I'll take a look at it, and I'll usually call back the referent. So the case manager, the police officer, the doctor who called me, and I'll get a quick update and kind of get all the information I need, demographics, and then I will likely leave and go wherever the individual is, if they're at Holy Cross Silver Spring, wherever that might be.
Oh, okay. Mm-hmm. And how long have you been doing this?
I've been on the team for about 2.5 years now.
Okay.
Yeah.
I also want to add, though, that we also get EMS alerts. So anytime EMS has contact with any overdose or substance misuse situation, they send an alert to us. So sometimes it's duplicative of the hospitals, like the hospitals will do a QR code for us. But EMS, if there's ever any kind of substance misuse going on, we get an automatic report. So in those situations, they don't necessarily contact the EMS worker, but they will go to the hospital where EMS left that individual.
Yep.
Okay, so let me get the sequence of events. So if a person overdoses in their apartment, the EMS comes and gives them Narcan, scoops them up, and takes them to the closest hospital. Mm-hmm. And then that's where that information gets transferred to you.
Yes.
Okay, so how has the response been from the hospitals? Are the staff really so glad that you're there to take over, or how?
Well, it's always mixed, right? There's a lot of shift change and turnover. Some people might not always recognize us. They might be new. Okay. And then there are other people who know us by name and know us by our faces and are happy to have us to come and help. So a little bit mixed.
Yeah, right now they're working on doing in-services. So because there's a big turnover at the hospitals, it's imperative that we do regular in-service meetings, which means that we will attend nurses' meetings, maybe the case managers meetings
Oh, good.
and introduce the team at least on an annual basis, right?
Okay.
To kind of like reintroduce ourselves because there's a big turnover, especially in the ER.
Right.
Right. So we want to, in order for them to know who we are and stay relevant, we have to attend those meetings.
Okay, so so you guys are the ones that actually train them about what a certified peer specialist is and how they could help, their job be less burdensome.
Exactly.
Okay,
Yes.
good. So you're
A
doing
resource
lot.
to them, yes.
Because it's a new concept, certified peer specialist is kind of a new kid on the block, so a lot of people in the treatment field are not even familiar with recovery coaches and certified peer specialists. So I know that people in the hospitals or, the police may not be familiar with what you do and why it's so important. So now once you get to the hospital, how do you approach the people? I mean, they're high because they just overdosed and, they're probably difficult to work with. How's it been working with the population that you work with?
Well, the population we work with, first of all, is very diverse, right? And honestly, it makes it easy because I have lived experience. I'm in recovery myself. I've been where they are. And what a peer is, it's about meeting someone where they're at. So when I walk through the door, I'm there to meet them where they're at. And that kind of cues me of how I'm going to approach them. And if an individual is too under the influence, I'm not going to have a rational conversation with them at that time. It wouldn't be ethical for me to talk to them when they're really under the influence, make any big decisions. But I do introduce myself. I let them know who I am and that I am here for them. I leave my card with them. I confirm number. And sometimes I'll even wait around for them to sober up a little bit for me to talk to them again and see if they're open to peer support or treatment. And maybe it hits the mark, or maybe they don't want anything to do with me. But a lot of times people who have declined, I get a call 6 months later and it's like, hey, are you that person? Are you the peer that came into my hospital room? I'm ready for help. So you just never know. It might not be in the exact moment, but we plant the seeds. So.
Right. Great. That's so important. Because it seems like you once you make the connection, that's really important. Because a lot of times people don't change they don't get epiphany where they change automatically just because you're there. It can be a process. It was a process for me.
Yeah, me too.
Yeah, one of the things that we believe, because this work is kind of heartbreaking at times, that we get people, they don't stay, and one of the things that I always drill into my team is that, it's our job to create the opportunity for someone to help themselves, right? Okay. But it doesn't matter how many times they've been, they've had the opportunity. Whenever they come, we present another opportunity because we don't know which time is going to be the time. So it helps manage our expectations of what our job is. Like, our job is not to save people's lives. Our job is not to be superheroes. We're not responsible for the outcome of someone else's recovery. But we are here to present opportunities for those people, no matter how many opportunities they need, right, to save themselves. Right.
That's great. Because, I don't know too many people. I work in the jail, and I see some people come back, a lot, and I'm saying and they have so sad stories, they have children, some of them have a lot of children, and the children are taken away from them, they're in child protection, and it's really heartbreaking. And yet they still are unable to change their behavior, unfortunately, even after treatment. Some leave, because I work in jail addiction services, and even after they've been in treatment for a year, getting the tools, the willingness to use the tools can be a challenge, And then the peer pressure, the lifestyle. The lifestyle can hold you hostage, It held me hostage for a while, where I was just stuck, And I wanted to stop, but I didn't know how, and the lifestyle was keeping me, doing the wrong thing instead of being with the winners doing the right thing, Yeah. So let me ask you this, with peer pressure, what ages do you see a lot today because when I was coming up and I was in active addiction, it was heroin, but now it's fentanyl. And I'm getting young people in the jail like 18, and they never used alcohol, they never used marijuana, they started on fentanyl. So what are you seeing?
Fentanyl.
Fentanyl.
And benzos.
The combinate both at the same time?
No, separate. But I think in the reality is it's not actual benzos or Xanax. It's pressed pills with fentanyl in it.
Oh,
so,
okay.
Yeah.
The counterfeit pills. Okay.
Yeah.
And I get people in the jail that actually that's what they want. They ask for, because they fake oxys, fake Oxycontin, fake Percocets, and they want it because it has fentanyl in it. And they come into jail with fentanyl habits really young.
Yeah,
unfortunately.
that's like a drug of choice now. Like,
Yes.
you know, you ask them what's your drug of choice, people will tell you fentanyl today.
That's really, and that's like really changed from years ago when fentanyl was mixed with the heroin originally. So that's the trend that we see today in the jail, and it sounds like that's the trend you see in the hospitals. What
Yes.
about the ages? What ages have you been seeing?
STEER is technically 18 years and up. We have a youth team that covers 18 years and below, and they work with Montgomery County Public School System. So, but our protocol is 18 and over.
Oh, okay.
And even if they get a younger person, they might orchestrate treatment. They might, you know, manage the treatment referral and then refer them over to the youth team to deal with for one-on-ones.
Oh, good. So you guys got it all. You got the STEER team, and then you have your youth team. And I've had them on the show.
Yeah.
They're really dynamic. That's great that they're in the schools, because, like I said, I just had an 18-year-old just leave jazz, and so I know that the schools are really having a challenge with fentanyl right now.
Right.
You know, years ago it was some young people that were talking about they just go through their parents' medicine cabinets and just take all the pills and throw it in a hat, and they just take whatever's in there. I thought that was crazy enough. But fentanyl, when you know that it's like killing people, is even more dangerous, and I guess it's an adventure to them, but it's really a danger that they haven't recognized yet.
Yeah, but one of the things we want to see happen is that that some of the people who are transitioning from the prison system be referred to STEER, right? It's a perfect warm handoff. We've been talking about this for a few years now, so I'm hoping that we finally get to that place where those people who are leaving the prison system aren't just walking out on their own. Like we walk with people coming out of treatment. We walk with people, you know, in other programs, right? But a person who's been in jail for a while, they need someone to help them make a plan. So it makes absolute sense. Right,
that would be great. I was wondering how we would do that, though, because I thought that you only can help people who overdosed. You can help, so a person can call STEER and just say, I'm using drugs and I need a peer specialist?
No, it doesn't quite work that way, but organizations can make the referral. The individuals can refer themselves back to the program. So if we've had someone prior to, that person can call us back later on and say, I need help again. So, but organizations like EMS, hospitals, crisis, the prison system, police, those are the people who actually make those referrals to STEER.
Wow, I didn't know that.
Yeah.
So I can make a referral.
You can make a referral.
Yeah.
All right. Well, we're going to take a break right now, and we'll be right back. So I'm James Sutton. My guest today is LaTonia and Katie from STEER, and we'll be right back.
I'm an ex-drug dealer, and I'll be your sub today. Can you see anything different as a pill?
No.
You don't know?
Fentanyl is being mixed into everything now. There's only one thing that will save somebody's life. That is naloxone nasal spray.
Fentanyl, it's cheap, it's potent, and it's profitable.
Why would drug dealers put a lethal dose of fentanyl in drugs if they know it's so harmful?
Really just all about the money.
I just didn't realize that one pill could change your whole life.
More kids should know.
I'm James Sutton. We're back with Road to Recovery. My special guests, LaTonia and Katie. So we were talking about the sequence of events for STEER, and we didn't get to talk about those people who actually decide to go to treatment. How has it been? Because my whole treatment career as an addiction counselor, I've never been able to get treatment on demand. That's been a thing nationally that we've been really working toward, you know.
Well, I'll add, like, one of the things that happened during the pandemic is that a lot of the treatment centers shut down.
Yeah.
And I was the director of the STEER team, and, you know, a big part of our job is getting people in treatment. So we invited like 8 programs to kind of report out what they were doing, like what their protocols were and how peers could engage with services, right? And so we met every week for 18 months throughout the pandemic, maybe longer, throughout the pandemic, and that town hall grew and their listserv grew out of it. So people were making requests for treatment through an email, right? So today, that listserv is now 498, the last time I counted, of programs in the state of Maryland and surrounding areas. So we have Delaware, DC, and Virginia also on that listserv. So now, not just STEER benefits from it, but all the peers in the community across the state can make a request for services, not just for treatment, inpatient, outpatient, transportation, food, clothes, anything that supports the person in recovery, workforce development. They can make that request. And the great part about it is, even if the service is not on our listserv, we've been working together so long, people will recommend other programs. So it's been a really great tool for cooperation across programs that wasn't there prior to.
Right, and that's like unbelievable, because normally businesses and competition, they don't want to really cooperate with one another. And
we changed the game on that.
You changed the game. And you know, kudos to you, because not only did you change the game, and you have treatment centers in the whole area working together for the population that we serve, but also it's cost effective, you know, and money is important, you know, to business. And the listserv is free, right? I mean, because
the listserv is free because we didn't have any money either, right? But we needed answers, and the thing is that, like, nobody literally gets left behind. So now, prior to, programs would turn people away for treatment, right? Like, you don't fit our protocol, and that was it. Now programs say, okay, we got this guy over here that needs a bed. We can't take them. Who can take them? And then, so there's enough for everyone.
Right.
And I think people have begun to realize that, like, working in cooperation, that, you know, everyone gets what they need, right? But no one gets left behind.
Right. And even though, you know, at that time, like you said, it happened because of a tragedy, because of the plague, because of COVID, where a lot of treatment centers weren't taking people because they didn't want to bring people with COVID into the population that were already there, and then they would get infected, and nobody really knew how to respond to COVID. But it's really, you know, grown into such, you said
498 was the last count.
498 businesses cooperating with one another to provide services for people in need. You know, and I've seen some of the requests have been for, like, couples that want to go to treatment together, people in wheelchairs, you know, all different kinds of, you know, specialty treatment that's very difficult to find, you know, accommodations for. But you've seemed to really, you know, come up with a great idea, and it seems to be working well.
It does. The team uses it. You know, I'll let Katie talk about that, how they've been able to build their connection with these programs?
Yeah, so obviously we have the listserv, which is great. So if we're ever stumped, we can post on there and we will get a response literally like within minutes from probably multiple people all at once of different options that we would have available for the individual. But a big part of STEER is, you know, we're for our clients. We serve our people. So we like to know where we're sending our people. So we do, you know, every month, multiple times a month, if it allows it. We do site visits. We meet different outreach providers. We want to see where they're going. We want to meet the counselors. We want to meet the case managers. We want to know where our people are going and if they're going to be taken care of. And from us doing that, we've built great relationships with different facilities, you know, across Maryland and surrounding areas. So now we have a lot of personal contacts there. So I can pick up the phone and call a friend basically and let them know I have an individual that might be a good fit. And a lot of times we're able to get people bed to bed same day because of that. Wow. And our relationships and ensuring, you know, our individual is having a positive experience. Are they dual diagnosed? Do they have a mental health component? You know, we know off the bat what program to send that individual to. Are they in a wheelchair? You know, do they need long-term care? Is that one of their goals? And you know, STEER is equipped with the knowledge and the relationships to put that person on the right path. You know, and we're not just about treatment, right? Like LaTonia said, we follow individuals and provide peer support for up to 6 months. So that can include, you know, a lot of case management, right? Connecting to community resources, different pathways to recovery if that's what they're interested in, and one-on-one peer support with a customized wellness plan with goals, right? Whether that's getting a job or fostering better relationships with their kids, whatever it is, we're going to meet them where they're at. So it's more than just treatment. It's a lot bigger than that. So yeah.
And that's really difficult. You know, when you have a person and they say they want to go to treatment, the window of opportunity is so small that, you know, if you tell a person normally come back in 3 days, you've lost them, you know. So if you can get, the closest you can get to treatment on demand, the better the opportunity to get that person some help when they really ask for it, right? Because they got to ask for it. Once they get back out there, they're gone, you know. You may see them again as an overdose. And you know, some of the people that work in the hospitals have told me that sometimes they see the same person twice in one day.
Yes.
They'll buy some fentanyl that knocks them out, and they'll be treated, and they'll go back and cop from the same person and not get knocked out again, you know, unfortunately.
Well, you know, if somebody overdoses, their chances to overdose again is higher than before. So that happens quite often.
Right. So let me ask you this, because I'm having a problem in the jail with finding staff, bilingual staff. You know, from COVID, really, a lot of people retired that really heart was in this field, you know, and they've been doing it for a while. They were very savvy, and the bilingual therapists, a lot of them retired too, you know. Has that been a challenge for you? You have bilingual peer specialists?
So we actually have 2 bilingual peers on the team.
Wow.
We have a female Spanish speaker, and we also have a male Spanish speaker. He also speaks 4 different languages, I believe.
Well, y'all rolling.
Yes.
He was a find.
Yes. So he was a find, and it was a mission to find him, but we did. So we are able to serve that population.
Wow, that's great. That's great, because Montgomery County has such a large Spanish-speaking community, you know, and especially down in Wheaton, I think we have more numbers with people using fentanyl.
Yeah, there's a big surge in that area, in the Wheaton area, Wheaton, Silver Spring. Kensington, I think. This area
Kensington too. I remember years ago, Gaithersburg reached out to us because they were having some problems. Is that still the case?
The whole county is really having a problem, but there's some hot spots, right? And those hot spots would be Silver Spring, Wheaton, Gaithersburg.
Okay.
You know.
Okay. So let me ask you this, because like we talked about earlier, that this work, it can really drain you because you see so many sad, cases, people that have, lost a lot, lost weight, they look physically beaten and they're not ready to stop yet. How do you take care of yourselves? How do you survive your work?
Well, a part of what we've always done is because we all have lived experience, we come from a place where we don't recognize trauma as trauma. And I kind of, during the pandemic, that became very obvious to me. And we started out, I had a therapist come in every once a month to kind of like they debrief with my team. So we don't do that anymore. But if I ever saw the need to do it again, we would. But what we do is we start every team meeting out weekly with self-care check-ins, right? Okay. So we've created a safe space for our peers to talk about like where they are, how they're taking care of themselves, because people sometimes think that this work replaces their own personal recovery, and then that leads to burnout, right? So we make sure that our team and our staff are all taking care of themselves, and we check on each other. We create a safe space where people can feel comfortable, talking about themselves and letting people know where they're at.
Good, good. Wow, you're a good manager.
I try.
Is she good? Is she a good manager?
She's very good to us. Yes, yes. We're in a unique work environment where we're able to talk about our feelings. Right. That isn't shamed. That's encouraged. It's important for us to communicate with what's going on with each other, because sometimes you talk about burnout, compassion fatigue. Those things come with warning signs, and sometimes when you're in the storm, you might not see it, but maybe she will, maybe my other coworker will, and maybe they'll be able to say something or say, hey, let me cover your calls for an hour tonight, or take the evening off, or go home early today.
They sent me home a couple weeks ago.
Yeah, so it's everybody. It's we all hold each other accountable, right? Yeah.
She tries to tell me what to do all the time. We've gotten better. She used to be the wild one, and I was the calm one. Now I'm the wild one, and she's the calm one. Right?
Oh my gosh.
So I know exactly what you're saying. It's good that you have a team that can work together and help each other. You not have the little politics where you're kind of jealous of and envious of each other. Because that's great when you can see a person's got a little too much on their plate, and you can kind of like help them out, take some of it. So that's great, Katie,
absolutely.
that you guys do that. And where are you located?
We are in Rockville.
Yeah, Rockville Town Center. And we're at 30 Courthouse Square. Our Recovery Community Center is in the bottom basement level. We have the entire bottom floor, Suite G1. And Rockville, Maryland, 20850. Our phone number is 240-390-6405. And you can call anytime, but from 10 to 6 o'clock you can call, and you can drop into the center. You don't need an appointment, Monday through Friday.
Oh, okay. Well, let me ask you this. What about Narcan? Do you have Narcan?
So yes, we do. We have free Narcan you can access at Tree of Hope. You can drop in and pick some up. Steer peers also carry Narcan on with them, so we're able to hand that out to the community as well.
Oh, okay. And we're about at the end. Is anything that we didn't talk about that you want to share in the closing minute? Did we cover everything that you really wanted the public to know about the viewers?
Let me think. Well, Steer has been around for a really long time. They've great numbers. They were actually the original peer team for this county, and they have been they set the bar for amazing work, right? Okay. We would like to have additional funding and additional peers to do the work that they're doing,
right? But
they've been phenomenal. Last year, they only had 3 peers working full time. They now have 4.
Okay.
But they've knocked their numbers out the box every time.
Great. Well, we're at the end, and you did great.
Thank you. Thank you for having us. Appreciate it.
So my guest today was LaTonia and Katie from the STEER team. My name is James Sutton. This is Road to Recovery, and I'll see you on the road to recovery.